we are going to discuss here today the oncology questions of pertaining to the MRCP exams. So let us take this first question. A 41-year-old lady is assessed in the oncology clinic following a diagnosis of grade 3 14 mm invasive breast cancer without any vascular invasion. There are 0 to 4 axillary lymph nodes were involved and excision margins were complete. She is elected for adjuvant chemotherapy and hormone treatments. Which one of the following endocrine agents would you prescribe for this lady? A, fulvestrant, B, letrozole, C, tamoxifen, D, anastrozole, and E, 𝒃𝒐𝒐𝒏. You can click and we can take on the discussion from there. Yes, participants, you can type it in your chat box or you can unmute yourself.
Tamoxifen.
Tamoxifen.
Anybody else? Any other choice? Who doesn't believe that tamoxifen is the right answer? Well, the correct answer is C, the tamoxifen, because tamoxifen is the first line adjuvant hormone treatment in premenopausal women. You remember that in this patient, we were talking about 41-year-old lady. So in a premenopausal woman, this is when we consider, we'll have to see that this is the tamoxifen. Aromatase inhibitors like anastrozole, they are used in postmenopausal women with ER positive invasive breast cancer who are at medium or high risk of disease recurrence. Tamoxifen should be offered to women who are at low risk of disease recurrence or if aromatase inhibitors are not tolerated or are contraindicated for any reason. So that is one you can have to understand. And these are the various potential treatments for breast cancer. So when the questions are asked, the questions may be picked up from any of these targeted therapies as well, the targeting receptors, RTK, targeting the other pathways, the AKTM, mTOR pathway, or targeting the apoptosis pathways, targeting the ncRNAs, the targeting the microRNAs, etc. So these are the various potential treatments for breast cancer. We all know that the local treatment includes surgery, radiation therapy, and systemic treatment with either chemotherapy or hormonal therapy. But in addition to this, the targeted therapies are also there, and we can have a broad overview of this. So tamoxifen is the correct answer, and we move on to the next question. Also, one more thing we have to say that in this lady, it is not appropriate to use aromatase inhibitor because the patient's ovaries, because this patient is premenopausal, the ovaries will be producing a lot of estrogen, which would drive further cancer development. Fulvestrant is one drug which is a new pure anti-estrogen which appears to be as effective as anastrozole, which is given by subcutaneous injections 1 every 3 weeks. And this is not currently the first line in postmenopausal women, but it may change in the near future. But so this is also about the fulvestrant mechanism of action is also depicted in your diagram below, and how it acts in the ER positive breast cancer cells, estrogen receptor positive breast cancer cells, by binding competitively to the ER and by inhibiting the estrogen stimulated cell division, and thereby reduces the number of estrogen receptors through degradation and downregulation. So this is the wholesome view of the questions pertaining to the use of tamoxifen in breast cancer that you can come across. Moving on to the next question. A 63-year-old lady is evaluated in the oncology clinic following a diagnosis of primary breast cancer. As part of her adjuvant treatment, she is advised to start treatment with anastrozole to prevent recurrence of her cancer. You all know that to prevent medium or high risk of recurrence. A dual energy, the DEXA scan, organized at the time of prescription reveals a T-score of -2.6, although she has no fragility fractures till date. So underline it that no fragility fractures till date. So what is the next appropriate step in the endocrine management of this lady? A, continue anastrozole and prescribe a bisphosphonate. Continue anastrozole alone. Stop anastrozole and convert it into 𝒃𝒐𝒏, or stop anastrozole and start tamoxifen. You can give your choice. Okay, Anjali has written A. Any other choice from anyone else?
I would go with A as well.
Okay. Anybody who is going with any other choice? Well, the correct answer is A. In the postmenopausal woman, the endocrine treatment of choice for preventing her primary breast cancer is an aromatase inhibitor. And this aromatase inhibitors work by causing severe estrogen deprivation, which increases the risk of osteoporosis. That is true. And this aromatase inhibitors can be continued in a patient who has suffered no fragility fracture. So in our patient, there was no fragility fractures, providing adequate measures are taken for bone protection, like prescribing a bisphosphonate, which was the choice in A. In patients who suffer a fragility fracture, in them, tamoxifen must be considered, as this have a partial estrogen agonist action on bone, and therefore it reduces the risk of osteoporosis. So that fragility fracture was the key underlying the trick in that question, so that this patient had no fragility fractures, making a candidate to continue this aromatase inhibitors and with along with a bisphosphonate. So you also know that what are the molecular targets. With tamoxifen, with raloxifene, etc., it is the ER. With the steroidal aromatase inhibitors like emaxetine, it is the aromatase or the estrogen. Non-steroidal aromatase inhibitors like anastrozole and letrozole also can work. The human epithelial growth factor receptor, that is HER2, and HER2 are targeted by Herceptin and pertuzumab, and the other factors are also there. So these are the different molecular targets. You can go through them, and any of these molecular targets can be picked up also as a question as a choice in some other, if the question is framed in a different way. Moving on to the next question. So this is also before that, this you have to know that approach to the treatment of breast cancer. In early breast cancer, it is curative. In metastatic breast cancer, it is palliative. In early breast cancer, initially it is locoregional therapy, where there is surgery to the breast with removal of the axillary lymph nodes, and then radiation therapy to the brain and the with or without the regional lymph nodes. In metastatic breast cancer, the control of disease with induction of tumor remission is based on systemic drug-based therapy and supportive therapies, and then followed with local therapies like palliative radiation therapy, stereotactic ablation, and so on and so forth. So National Comprehensive Cancer Network guidelines have recommended the post-menopausal hormonal therapy plus in metastatic bone cancer, in metastatic breast cancer, to divide them either hormone responsive or hormone unresponsive. So if the patient is hormone unresponsive, or anybody? So if the patient is having hormone unresponsive or life-threatening disease, then the patient goes for first-line chemotherapy, check progression. If it progressing, then second-line chemotherapy, check progression, then third-line chemo, etc. If the patient is having no life-threatening disease or hormone-responsive breast cancer, then the first-line hormonal therapy, followed by a median of progression-free survival. If it is between 10 to 13 months, then there is or there can be no response. If it is no response, then the patient goes to receive chemotherapy from the hormonal cycle. Further hormonal therapy is discontinued. But if the patient has a progression-free survival of 10 to 13 months, then the patient goes for a second-line hormonal therapy. If the patient undergoes again after a median of progression-free survival of 3-4 months, and then there is progression, then third-line hormonal therapy. In case there is no response, the patient moves into the chemotherapy line. So you can see there are two boxes: the first-line chemotherapy and the first-line hormonal therapy, and determining the sites and extent of the disease symptoms, the ER status, the HER2 status, the disease-free and the treatment-free intervals, and the performance status. All of this divides this patient into two groups, and they proceed accordingly along this flow chart. So this is a very important National Comprehensive Cancer Network guidelines that is important for postmenopausal patients with hormone responsive and metastatic breast cancer. So this is also an important aspect. And if you see the adjuvant endocrine therapy in early breast cancer, the key developments which have taken place is that adjuvant endocrine therapy significantly improves the organ functioning, and if you see that this aromatase inhibitors further improve the disease-free survival versus tamoxifen. And one important is that the ovarian function. because if the ovarian function there for premenopausal ER-positive breast cancer, there is added benefit with tamoxifen and in women who are less than 35 years of age. So this is also an important adjuvant chemotherapy one has to remember. So if one can go through this charts and one can keep it in mind, then probably one will be able to understand the questions easily and would be able to take the correct response. Moving on to the third question. Now coming to a different disease, a 28-year-old lady is noted to have some bruising on her limbs with a palpable spleen on the abdominal examination during an ongoing investigation for infertility. The investigations reveal hemoglobin is, it is 10.3. The total leukocyte count is more than lakhs. The neutrophils is 58%, as you can see. Myelocytes 38%, 2% lymphocytes, and 0.7, 0.2, 0.5 of basophils, etc. And you can see that there is thrombocytosis. Platelet count is exceeding 8 lakhs. So in this condition, if this is the blood picture in a patient, 28-year-old lady who is having bruising of her limbs and a palpable spleen during investigation for infertility, which of the following is the most likely diagnosis? The choices are A, myelofibrosis, B, CML, C, AML, D, essential thrombocythemia, and E, acute promyelocytic leukemia. Yes, what would be your most likely answer? You can unmute and respond. There is one in the chat box. Let me see. They say Bihina Suleiman says B. Anybody else?